मेरा नाम अंगद सिंह है and she is my wife Avneet Kaur. We had our first son in the month of June 2021. He was absolutely okay and doing well until 8 months. But 8 months के बाद suddenly dysentery start हो गया, loose motion start हो गए. And initially तो we were in Mumbai. तो हमने OPDs में डॉक्टर को दिखाया and it was normal treatment. नॉर्मल जो भी था, they were trying to diagnose कि क्या है, but the motions were not getting controlled. And he was बार बार जब भी हम डॉक्टर्स के पास जा रहे थे, the point was that he was unable to thrive. The kid was unable to thrive. तो pinpointedly it was not getting diagnosed कि problem क्या है. And when it got a bit of diagnosis जब हुआ भी, तो they were telling us directly to go for the major treatment. And we were as parents हम बहुत ज़्यादा scared थे to directly go for that treatment. And meanwhile we came to know about Dr. Sufla Saxena in Manipal Hospital. We came to her first time in the month of July 2022. The kid was admitted here for about 15 days. The best part what madam did was she run the entire test. जो भी test हो चुके थे वो भी उन्होंने फिर से किए, सब कुछ उन्होंने check किया. And when finally the problem was diagnosed, उन्होंने ऐसा नहीं बोला that you go for the final, आप जो डायरेक्टली जो ट्रीटमेंट है उसके लिए जाओ. शी स्टार्टेड विद द इंटरमीडिएट ट्रीटमेंट. जो मेडिसिन थे इनिशियली वो स्टार्ट किया एंड उस मेडिसिन से फर्स्ट टाइम इसका जो डायरिया था दैट गॉट कंट्रोल. ही वॉज एबल टू थ्राइव. जो भी मोशंस थे वो कंट्रोल हुए एंड वेट गेन स्टार्ट हुआ बेबी का. एंड वहाँ से लेके अब तक द किड इज वेरी गुड, इज डूइंग फाइन. And we want to thank you Manipal Hospital and Dr. Sufla कि उन्होंने she treated the baby like her own. वो आज भी she is still in touch with us and thank you Dr. Sufla and thank you Manipal Hospital.
When the baby came to us, he was extremely unwell. He had really bad chronic diarrhea which he was suffering for almost more than 4-5 months. So we had multiple challenges to begin with. Initially the challenge was to make the baby stable and the survival. The second challenge was to make the diagnosis, because these parents were getting the treatment at different places and the child was having bloody diarrhea for a long period of time and he was not getting better. He was not able to thrive. So when the child came to me, he was almost 1 year of age and he was weighing only 5 kilos. So we did all the investigation which was needed, followed by an endoscopy and colonoscopy to reach a definitive diagnosis. And eventually we did a genetic test which showed that the child suffered from a very rare disorder, that was LRBA Deficiency, DEEAH Syndrome. I started him on some symptomatic treatment initially and then we started him on some definitive treatment, following which the child started showing improvement. In chronic diarrheas, it is very important to know what exactly is the diagnosis, because then only you can plan the management of the child. Not only that, if it is a genetic condition, it is very important to give or provide proper prognosis to the parents. So we provided them with all the support in terms of giving genetic diagnosis to the parents also. And it's been now over 2 years. The child is doing really well. He's growing well. He's thriving well. He's achieving in development milestones. And I'm very pleased to know that he has also started attending play school. He has got a sibling as well. And he's been advised a definitive treatment, probably, bone marrow transplant for future. I wish him all the very best for his future. And I will like to end that chronic diarrheas are really challenging. They need to be properly diagnosed and treated, and very importantly, a good prognosis or what is the long-term outcome for such patients have to be told to the family.